30,000. These are the figures provided from the doctors and helpers working in the camps, in the hospitals, in that area. But these are approximate. Still, we don't know the exact figures, but these are the approximates what we know until now. So immediate basic needs of these internally displaced people from Benny. Our organization is hard. Sometimes people ask that, can you do that? Can you help them? No, it's not easy. Sometimes it's not possible. But because of our close link and relationship with the grassroots organizations, doctors, institutions, and other volunteers there, we were able to identify the needs and infuse the help without much advertisement or prominency. So we were able to provide this help for the internally displaced people, at least to a limited extent. The next projects we are planning to do is we know the largest camp is the many camps, more than 200,000 people, and further people are relocated into this camp. There are 4 zones, and the zone 5 and 6 are being created. So there's not enough toilet facilities there. People need to wait in the queue for hours. They say at a time, at least 100 people in queue for go to the toilets. So the monsoon rain is coming, and danger of infectious disease like diarrhea, cholera, and typhoid is there definitely. So we have to save the lives of these survivors. These people came after all these difficulties, war, bombings, and everything, but every day there are 10 to 15 people are dying. The kids, elderly people, and there are preventable deaths too. So we are working on that. So prevention of these diseases, they need the extra toilet facilities before the monsoon rain. So these basic toilet facilities, this is not the permanent one, it's relocatable. It costs about 35,000 Sri Lankan rupees. That's $320 or $325 here. We need 500 toilets need to be done. Already funded 400 toilets. This for the providing extra water supply. Then the primary healthcare center or the mobile clinics there. We started doing the mobile clinic initially. The people, displaced people are held in the government buildings, 55,000 people at that time. Then we extended our service to the many camp too. Getting the doctors initially from the south of Sri Lanka too, because at that time the influx of internally displaced people more than 10,000 per day. So we need to we need to mobilize more doctors needed. Apart from this, attending these acute needs, we need to we are focusing on the long-term needs too. We need to do a massive rehab program. We are attending the mental health and psychological support of the people too. We funded a building of a psychiatric unit. Was started before the crisis time, and it's completed now. It is functional with 16 beds, and there are 2 psychiatric doctors working there with other volunteers too. And also we need to help the families to reunite, and also we need to work on the amputees to get the prosthesis and the proper rehab therapy following that. And also we need to focus on the resettlement to their own villages at the earliest time. So our work, we mainly focused on Vavuniya, Mannar, also IDP, 12,000 IDPs in Jaffna camps. There are 12 camps operated in Jaffna, mainly in Savagacheri area, and also help the IDPs in Trincomalee. We were the organization, only organization able to deliver a supply of a milk powder as per the request of the doctors at that time, Dr. Satyamurthy and Dr. Bharadaraja at that time, into the conflict zone initially through the Red Cross. This was done with the help of our professional body here, CMDDA. This is the mental health unit I talked about. It's constructed and it's functional now. We initially, when the IDPs arrived in the Vavuniya town, and we helped them with the extra nutritional supply for them. This was 60,000 per month. It's for 2 months. For the healthcare center in Vavuniya, it's for the medications for the mobile teams, 40,000. And in the Chetikulam camp, so when the refugees came into the Chetikulam camp, 200,000 refugees. Initially, the Chetikulam MOH is teams able to go and work there. There is a huge need there. It's not possible for few doctors or few nurses to attend the need of all these people. So as per their suggestion, they identified already the healthcare workers there among the displaced people. We identified them, 300 of them, and we've provided them with the initial hygienic packs to start working there, and we are giving them incentive of 5,000 Sri Lankan rupees per month for them. Already 100 of them started working there. Among the displaced people, if they are working on the health education, simple treatment of the diarrheal illnesses and prevention of infectious diseases, and identifying the vulnerable cases for the referral to the medical team on the working on the site. Need for the doctors, there are doctors working there not enough, and also there are non-Tamil speaking doctors from south of Sri Lanka working there too. So there's a strong cultural and language barrier. So need for the Tamil speaking doctors is urgent, and we are working to get the doctors from Jaffna Teaching Hospital. That's 60 doctors volunteer to come and help in the camps on a rotational basis. So we are ready to provide them the air transfer from Jaffna to Colombo, and land transfer from Colombo to Vavuniya, and the accommodation and other facilities for their stay in Vavuniya. We allocated 15,500 for the 2 months. Already few doctors arrived after getting the clearance to work there. This is sanitation needs we talked about before. When the war victims arrived from the conflict zone initially, there were amputation, shell blast injuries, bomb injuries. So those people were treated in Trincomalee Hospital, Manna Hospital. These hospitals needed additional extra surgical supplies and medical supplies. We funded them. Lately, we are working on the logistics of adoption of kids. So there are kids, I said there are 1,000 kids. They lost both of their parents. So we are trying to adopt help. We are not going to directly adopt. We are going to facilitate this. So we are trying to help a place called Sivananayam in Mannar to help 300 kids initially. So the cost for adoption per kid is $40 per month. This is still being worked out to clear the logistics and situation there. This is again medical supplies for the Trincomalee Hospital when the injured people arrive there. This is the milk powder. This is the second shipment of milk powder, originally meant for the conflict area, but it couldn't unload in that area because of the intensified war during the last few days. So then it was unloaded in Jaffna and distributed to the displaced people in Jaffna district. And Jaffna Hospital again treating the extra patients, needed extra medicines and supplies. We funded them. And this Varani Hospital, that's Varani and what do you call it? The Tenmanachi area is the area where the refugee camps, 12 refugee camps, 12,000 refugees are there. This hospital maternity ward was renovated, and now pregnant mothers from the camps can come for delivery and stay there for an extended period of 3 months in this hospital. That arrangements we need. Also, the only serving inpatient hospital for the refugees in Jaffna.